Hello, Professor Kar. Hello, everyone. Hope all are doing well. A very good morning or good afternoon to all of you. And my name is Manish Sharan, and I'm from the group 2. And today I'm going to give a presentation on application of business analytics in the healthcare. So before I proceed with the presentation, I need to let's discuss something about what business analytics is all about. So it is the iterative process of exploring past performance and current data to gain insights, predict future outcomes, and make data-driven decisions for business improvements. It also involves, using skills, technologies, and practices to analyze vast amount of data and identify, trends and relationships, and ultimately transform raw data into actionable insights that drive strategy, optimize operations, and lead to profitable choices for a company. So this is about a brief introduction about what analytics is all about. Now moving further with the presentation. So this is the first slide of my presentation, which says introduction and why healthcare needs, business analytics. So the American healthcare system, which has long suffered from constrained resources, increased demand, and questionable values, yet future looks more promising due to increasingly sophisticated and widespread uses of data and analytics. And past performance of the healthcare system provides insights regarding why change was and still is necessary. So the Centers for Medicare and Medicaid's system, right, establishment that healthcare represents a staggering 17.9% of US gross domestic product, and that the United States spent 2.7 trillion or $8,680 per person on healthcare in 2011. So, according to the Organization for Economic Cooperation and Development, that's OECD, which ranks the performance of international healthcare system, the United States ranked 27th in the life expectancy at birth in 2009, despite having the highest proportion of GDP spent on healthcare. That's what this, like the first 2 point, it means here. Now, of course, there were some problems, right, which the healthcare system was facing, right, which actually raises the questions regarding the value of the US healthcare system. So the first problem was like there is a lack of aligned incentives in the existing, fee for service system, which promotes consumption of resources and overuse rather than usual patients' health and well-being. Also, despite information technology role in rapidly advancing the productivity of many other industries like Raleigh and Simcoe, so IT adoption in the healthcare has sorely lagged behind. So that was a major problem. And to provide the solution for these problems, there were two acts which came into picture. So first is the Affordable Affordable Care Act, that's ACA, and the Health Information Technology for Economic and Clinical Health, that's HITECH Act. That is a component of the American Recovery and Reinvestment Act, 2009. And these acts have, initiated tremendous change in the healthcare system. I would say by adoption of at least basic electronic health records, that's EHRS. Okay, so EHR adoption sets the stage for electronic data collection and subsequent analysis. So the next phase uh, entails transforming these data into actionable information packets that can be used to improve healthcare delivery. So this was the solution given by these acts. Now moving on to my next slide, it says analytics process in healthcare. So there are four stages, right, in the analytics process of healthcare. That is data generation, data extraction, data analysis, visualization, and reporting. So let me start with the data generation first. Okay, yes. So this is data generation slide. So when it comes to data generation slides, there are some sources through which the data gets generated. First is EHR. Data gets generated in the healthcare system. First is EHR, electronic, health record, and its like abbreviation is EHR. So EHR have become one of the largest sources of digital information on the health and well-being of patients. So EHRs are used to capture family, social, surgical, and medical history, and allergies and immunizations, laboratory results, clinical findings, clinical orders, and other condition-specific information depending on the configuration of the EHR. Okay, so this is how the EHR works. That's basically it talks about the patient history and the test results. Now the second component is laboratory information management system, that is LIMS. So an LIMS is used for processing laboratory samples and for sharing the interim and final results for a particular test. So this system typically contains sample metadata and for example collection data or time, container type, preservative, that are useful for quality assurance purposes. Now the next is diagnostic equipments like MRI, CT, ECG, vital sign monitors, right? So these are some kind of instruments which is used for the data generation. So some instruments will simply generate a text report that is transmitted to the EHR. Other may produce images or other raw data that can be used for analytical purposes like radiology, picture archiving, and communication systems for improving management of these imaging databases. Next is insurance claims and billing systems. So these systems are used to generate bills for services during each clinic or hospital visits and keep track of what was paid by patients, insurance providers, or other payers. Now, going further, we have like human resources and supply chain. So many healthcare system now use typical enterprise level IT systems, example PeopleSoft, SAP, to manage their human resources and supply chains. Okay. So this is about the data generation sources, that how the data gets generated. Now moving on to my next slide, it says data extraction, challenges and solutions. So when it comes to challenges, so it says like lack of interoperability, inconsistent formats, vendor lock-ins, right? So the lack of interoperability creates significant challenges for healthcare providers, patients, and industry at large. So the inability to effectively share and exchange data can lead to delayed care, redundant testing, and even medical errors. So despite of these challenges, or efforts are underway to facilitate data sharing and exchange through data formats standardization. The primary drivers behind this are MU regulations. So they call for clinical findings to be coded to SNOMED, CT, laboratory results to be coded to logical observation, identifier names, and codes to be coded to RX norms. So within the research community, such mappings are standard when performing institutional analysis, making them standard throughout the industry, which will signify the reduce the burden of sharing data in a coherent fashion. This was about the solutions, and also there was initiatives like Blue Button, which allows patients to download the health data. So this Blue Button initiative was launched to enable patients to view and download their personal health records electronically, and it began in early 2010 primarily with the effort of Department of Veterans Affairs and Center of Medicare and Medicaid Services, CMS. All right. So now we have some data analysis techniques, right? At how the data is analyzed. We have some traditional ways, some modern ways, and some focus. That's about the future. So talking about the analysis techniques, data scientists often need to draw from a dizzyingly broad spectrum of analytics methodologies. Well-established techniques such as biostatistics and epidemiologic analytics, Monte Carlo, and discrete event simulation and causal modeling are being joined with methods previously uncommon in the healthcare. So these newer methods include data mining, uh, Bayesian statistics, optimization modeling, social network analytics, and agent-based simulation, just to name a few. So this clinical analytics involve improving patient care. This type of data is very different than process-oriented data and may include genetic data as well. Genetic data as well as clinical records, which are often narrative and may be more difficult to analyze on a large scale. Also, EHRs were not designed with system performance in mind and figure out how to capture these data with high quality at low cost. So this was about the data technique analysis. After that, we have the next slide, which is let me see, data technique analysis. Just 1 second, guys. Visualization, and yes, the next slide we have is uh, how visualization and reporting is done in the business analytics of healthcare. So traditionally, healthcare has used business data far less regularly and comprehensively than most other industries. So it has underinvested in advanced managerial not technologies like reporting systems and data visualization. So, whereas many organizations outside healthcare have developed or purchased real-time reporting systems that push targeted updates to the specific users, healthcare has typically relied on the centralized product of static, undifferentiated report. Okay. And it improves the data decision making as well if we have a better visualization and reporting tools, so that will certainly improve the decision making speed, so we will have some kind of good accuracy and confidence as well in the healthcare management. Now there are some challenges in the healthcare analytics, and challenges like managerial issues, then we have some data quality, and then data collection, competitive and privacy concerns. So these are some kind of like problems or challenges or barriers and issues in the healthcare analytics system, right? So if we talk about the managerial issues, so in healthcare, the foremost concern for management is the people that compromise it. So namely the key stakeholders, be they patients, physicians, nurses, or other medical staff, referring providers or representatives from the local community. So these are some people, and you know, uh, these individuals and increasing the quality and transparency of decision making are key goals for any business analytics initiatives. Therefore, because of the pervasive influence these systems have, the organization needs to establish business analytics and an organization and cultural objective. A component of it is in a long-term strategy. So that is the managerial issue. Then we have the data quality issue, because some data elements are captured in a more consistent fashion and on a greater percentage of the patient's population. So most EHRs are designed to allow the same piece of information to be captured in many different ways. Uh, a diagnosis, for instance, could be listed for on a patient's problem list, or in his or her medical history, billing records, reasons for visits, clinical narratives, etc. So, in most cases, however, when conducting a population level analytics, so one needs to remember to look in all possible locations where data may exist. Otherwise, the user is left with population which has data in the locations being searched. Okay, so this was the about the data quality. Then we have data collection. So basically in data collection, data quality and data collection process are actually linked in some way. So once data quality is compromised, it can be tremendously expensive to overcome. Therefore, it is critical to focus on high quality data collection. So as a best practice, instead of collecting as much data as possible, institutions should actually take the opposite approach, ensuring that they collect the minimum set of data elements required. It's far better to have a small data of high quality elements with a high competition percentage than the large set of spotty coverage. So that was about the challenges. Now we have some applications for analytics. First is so these are the applications which are used for the analytics purpose. That is the dashboards and control charts that monitor the key matrices. Then we have genetics in the healthcare system, which integrate the genomic data for personalized medicines. We have comparative effectiveness research, that's cost benefit treatments. We have chronic disease database, which supports, learning health systems like LIS, sorry, LHS. And then we have disaster planning. So disaster planning application will help. It helps a lot when we have some disaster situations like earthquake or some kind of plane crash or some disaster like hurricanes or snowstorms, some kind of infectious diseases, right? Plane crashes, building collapses. So we get support, we get the resources allocation during the crisis. So this is that application. Then we have patient flow optimization, which this with this application it reduces the waiting time and improve the efficiency. And then the last application is RFID tracking, which helps to locate assets and monitor compliances. Right, so these are the applications which are used in widely used in the business and analytics in the healthcare process. Now, to conclude, I would say that business analytics can transform healthcare, give it can give better outcomes at lower costs. So the key hurdles that we have already discussed is its privacy, the quality of data, the standardization, the skilled workforce, and of course the future is like analytics central to achieve high quality, responsive, and affordable care. So that's all from my side. Thank you for giving me your time and have a great day ahead, everyone. Thank you again.